Today on Catholic Health Conversations in Care, a look at Catholic Health's emergency medical services and the dedicated team caring for Long Islanders 24 hours a day, 7 days a week. That's next. Welcome to Catholic Health Conversations in Care. I'm Colleen McVeigh. And today's conversation is all about who we turn to during a medical emergency or crisis. Now, chances are most of you have been to an emergency department for yourself or for a loved one. And you know it can be a very frightening, nerve-wracking time. A time when you need the best emergency medical team and compassionate care. And that's what you get at Catholic Health's 6 Long Island hospitals. Joining us today for today's conversation is Kevin Ferrati, Catholic Health's Vice President of Emergency Medical Services. Kevin, welcome to Conversations in Care. I'm so happy you're here.
Thank you for having me.
And it's an extremely exciting time. You are the person to talk to. Something very new at Catholic Health. Let's talk about the new in-house ambulance service.
Yeah, I am so blessed and so fortunate that on St. Patrick's Day, we went live with our own operated EMS asset that we have purchased from a private ambulance company, brought over 180 new EMTs and paramedics into Catholic Health to ensure that we are providing emergency and non-emergency ambulance transport coast to coast, across Long Island, and into Queens.
Talk about the size of the service.
So we have more than 27 ambulances, paramedic response vehicles, our own in-house EMS dispatch. So truly from the moment someone starts to feel ill all the way through definitive care, you know that Catholic Health Ambulance is going to support you amongst each step along your patient care journey.
So why have an in-house service? What was it like before? What's the difference?
It's critical. When you have an in-house service versus using multiple vendors, you lose the continuity of care. You lose the quality of care. So with Catholic Health Ambulance Service, now we're able to actually take that care that you're receiving in the hospital, in your doctor's office, across Catholic Health, and then bring it to your bedside in your home and ensure that quality of care, that safety of care, and that caring, compassionate provider that you're used to now happens at all steps along your journey.
Okay, so how does it work? How do I find a Catholic Health Ambulance Service?
Easy enough.
Okay.
From the moment you start to feel ill to the moment you think you need to go to the emergency department, call us. We have a Center for Care Coordination based out of Melville that serves all of Long Island, and we have 24/7 EMS dispatchers ready to not only triage the type of response that you need and the right ambulance that you need, but most importantly at the right time that you need it.
And I think it's important that we will be putting that phone number up, which I do have. But you have to have that phone number with you really at all times, at your home, right? I mean, this isn't a matter of calling 911. You have to call Catholic Health Ambulance Service.
Absolutely. And we will also triage. So if you are confused or if you don't know whether or not to call 911, you can call us. We have trained clinical providers that are sitting at the will of that phone call. And if we feel like we can't get there fast enough, we will move that and we'll have that nice handoff. But it's more so about preparing you to the emergency department, making sure that the care teams in our emergency departments are ready for you, which is why calling us is so critically important.
And how do you get the emergency department ready?
Yeah, so by coordinating the care from the moment that you're dialing and we're responding, in the background, we're advising and we're activating the emergency department. We're pre-registering you into our emergency department. So the moment you arrive, you're going to the bedside, that care team already has your record pulled up. They already know what to expect for you. They can put you in the appropriate room with the right team. So from the moment that care is, there's not a step missing along the way.
Wow. You know, you said it actually went live, or you launched it on St. Patrick's Day. Yes. What a great day.
Luck of the Irish.
Luck of the Irish, for sure. So the kind of responses you're getting from Long Islanders.
Yesterday, I received the best phone call, and our interim CEO, Gary Havokin, who's also a paramedic by trade, said it best. He said, this is what Catholic Health does. And this person not only called us from an emergency situation, but then had to use our service multiple times thereafter. And she said from the moment that she got in the ambulance each and every time with different providers, she knew that quality care, that compassionate care that we expect all of our caregivers to give across Catholic Health was going to be there. And she felt it across each of them. And she said how genuine. And she actually ended by saying, I love them.
Oh, and I like the idea of the coordination. You know, if my doctor is already with Catholic Health, the minute I call Catholic Health Ambulance, it's all there, right?
It's all there, and we will help even for those patients that don't have Catholic Health we will still help you with that care. We will still transport you to the facility that is most appropriate for your care. But within our system, we have that continuity, and we are all supported on the technology side. So our caregivers have the resources, and now our patients have the same resources.
And this didn't just happen. You've been working on this for a while.
For 2 years, And that's where, we have a fantastic team at Catholic Health. Everybody from our technology team all the way through our billing, and most importantly, our clinical providers, day to day providing that care at the bedside in our emergency department. And by rolling this out the way we did, we are now bringing that care in the emergency department right to the bedside of the patient and the residents.
And this just started, expansion plans, your
Expansion,
vision?
absolutely. We are so excited. We want to make sure that personalized, coordinated care that you feel and you expect out of your caregiver is now happening at all points of your care. And we want to be the leading provider of that. We know that we are going to be the best at providing it across Long Island and into the New York City area.
I read, and that's it too, New York City. This goes, how long? I mean,
right into
our
the borough
island's
of
very
Queens.
long.
Right into the borough of Queens. We're going to come and make sure we're starting that care journey for you.
Okay. So looking more to the future, the expansion plans?
Expansion plans is really from that moment of symptom onset.
Okay.
You need a trained professional caregiver to help you with that, to guide you through that. And that's where our Center for Care Coordination comes in. And then along each of those steps, if you need an ambulance, we're going to provide that, both in an emergency situation, we're going to be able to coordinate that for the fastest time that you want, not when we're able to give it to you, but when you want that care, all the way through to the end point of care. We're going to make sure that that is coordinated in a sound fashion, providing the safest but highest quality care possible.
Talk about this partnership that you have with local universities, which I find so interesting for the next generation of EMTs.
Absolutely. So healthcare is in dire need of the future, and we need future professionals. And so having an EMS resource now combined with all of the great work that our providers and our staff is doing, our colleagues are doing in the universities, we are now bridging that. We're bringing the EMT programs, we're bringing the paramedic programs. So now not only are we developing a career for those that want it in the pre-hospital, but now what we're also able to do is start that person's career as an EMT and help them guide their journey through Catholic Health and guide their journey through the healthcare industry, all through while growing their own professional interests as well.
Are you seeing a need for EMTs?
Absolutely. We need EMTs, we need paramedics, we need those that are interested in not only supporting us, and if you don't want a paid position, reach out to your local fire departments. Volunteer, help, because we need help at all areas of healthcare. And this is not a local issue, this is a national issue.
If we go from, the ambulances are these little EDs on wheels, that's what I like to call them. But let's go from the ambulance to the actual, emergency department. And we've been watching even just this year, Good Samaritan University Hospital, the expansion of that ED, the changes and expansions we're seeing in Catholic Health with our emergency departments.
Yeah, we point to two things. We point to access, we point to quality. And we are providing the right access. We're expanding access across not only just our emergency departments, but in our communities. But then by allowing us to expand and grow the way we have with the support of our great board and our great leadership team, we're providing the best care possible in the right spaces at the right time, using and developing that with the best and most advanced technology possible. And that's what you're seeing at Good Samaritan and at Mercy and elsewhere.
I say, I really would like to know of anybody who hasn't been to an emergency department, and I hope you have not been in a while. And for someone who hasn't been in a while, it might be a different experience now, the way, emergency departments are run.
It can be intimidating, but that's really where I love our colleagues, and I am so fortunate to represent them the way I do, because I can tell you, as chaotic as an emergency department is, the nurses, the providers, and the thousands of support people behind them, making sure that that experience is the best possible, regardless if you're going there for a common illness or your most traumatic incident.
And that's it, yeah, it's broken bones to heart attacks, you know. But I know a million years ago when I went with my children were young, what is new now, they did not have actual pediatric sections for children, right? I mean, even those are the kind of changes that I thought, wow, that's so important.
Good Samaritan specifically, level 1 adult trauma, level 2 pediatric trauma center in your community, right down the road. But what is most important about what we're doing at Catholic Health is we're taking that into all of our hospitals. So our advanced critical care and cardiac care teams of St. Francis is now at each of our campuses. Our teams, our providers. But one thing that sticks out is the connection of that personalized attention to your caregiver combined with technology. So we are now supporting our caregivers with the technology that they need to do their job faster, more efficient, and at a higher quality.
Very quickly, just a little bit on emergency department etiquette. Just for someone, again, to know what to expect when they get there, because it's really not first come, first serve at all times, right?
Yeah,
what to expect.
We follow the model of compassion and respect, and understanding that your caregivers are oftentimes seeing the worst of people in their worst dire condition. That is not that person, that's that person in the moment. And that's where our caregivers have that compassion that they see. So the compassion and the respect in return is often something that we not only expect, but we respectfully ask for, because our caregivers are going to triage the most dire sick patients first, but they're still going to make sure that you're still receiving that level of care that you expect out of your local emergency department at the highest possible care that they're able to give.
Yeah, and I think it was, I don't know if I was watching an interview with you, it was just like maybe no cell phones? Or was it in an ambulance? Maybe could we turn our cell phones off or just put them to the side, if possible, right?
That's generally a good social statement as well. But
it's true.
I think the biggest thing is that, look, first responders in general, healthcare providers are under extreme stress. And that's where what we're doing at Catholic Health is ensuring that their mental and also their physical well-being is cared for, which is also then going to make sure that those moments where people are not acting to their highest capabilities and best is going to come through.
Because we know, like I said, everybody's under stress, and everybody's scared. A lot of people are scared in that room, so it's or that department. So it's just like, okay, let's just be kind to each other. That's all. But I want to make sure we talked about it earlier. There is a special phone number to call if you live in Nassau County, 516-465-6700. Suffolk County, 631-465-6700. And you can also go on the website, Catholic Health, for more information, for general information, it's cathochealthli.org, or call 866-MY-LI-DOC. Kevin, thank you so much. We have more to talk about because I want you to stay right where you are. Coming up next, the Catholic Health EMTs who helped save a family of 5 from their burning home. We'll be right back.
On Long Island, there are families facing challenges every day, struggling to make ends meet, searching for hope. That's where Catholic Charities of Long Island comes in. We are a beacon of compassion in the name of Jesus Christ, offering support and services to all those in need. From providing hot meals to homebound seniors, shelter for the homeless, counseling for those facing despair, Catholic Charities of Long Island, with our faith, finds a way. Catholic Charities of Long Island. Join us putting our faith in action.
When you come to Catholic Health Cancer Institute, we'll get to know you. Every detail, from the genetic makeup of your cancer to your other health conditions to your emotional and physical needs. Because each detail gives us another opportunity to personalize your care and improve your outcome. And all of them can add up to a life-changing difference. At Catholic Health, we know you, we know cancer, and we know your cancer.
Welcome back to Catholic Health, Conversations in Care. Well, today we are talking about Catholic Health's Emergency Medical Services and its life-saving team of doctors, nurses, and other medical staff, including 2 of its EMTs, who are being hailed as heroes. Recently, their CHS ambulance was on a routine patient transport that turned out to be anything but routine.
On May 21st, my dad was being brought from the hospital back home in a Catholic Health ambulance by the Catholic Health team. And as he was being transported from a driveway into the house, fire broke out in the attic. The air conditioning unit apparently caught a fire while the technician was working on it. So during that uncertain, unforeseen, catastrophic event, the technician who was there on site, he immediately took the action to make sure that everybody was safe, and he brought my dad back into the ambulance, make sure that he was well taken, safe back to the hospital. It was my opportunity to appreciate, express my gratitude in person to the team, and I just absolutely was thrilled to take that opportunity, because not many times people get to meet EMT personnel in person. So this was something that I was really glad that I got that opportunity to thank them in person and to express my gratitude. My dad is in rehab. He is obviously much better now than he was 3 weeks ago when this unfortunate situation happened. And yeah, we are obviously trying to gather up our day-to-day lives back to normalcy as fast as we possibly can.
The event was unusual, right? You know, you're thinking typical discharge from the hospital, you know, routine driving the patient home, getting things ready, trying to transition the patient from hospital care to home care, and you pull up and you see, you know, smoke coming out of a house with flames. You know, in a situation like that, you know, your instincts kick in. You know, the first thing he did wasn't call 911, right? He went and rescued and told the people to come out of the house and made sure that was taken care of before, you know, calling 911. But it's a very, you know, unique situation. You don't ever really see that happening. So it was fortunate that transpired that way.
We were bringing Mr. Shaw home from St. Charles, you know, routine discharge, do 5 or 6 of those a day. And I was going upstairs to see where Mr. Shaw was going, and as I was walking up the stairs, I could see into the attic, and the attic was engulfed in flames, you know, smoke, fire, the whole 9. So I knew as soon as I saw it that it was beyond anything I could handle, that I needed to get everyone out of the house, you know, make sure everyone got out safely, call 911, move the ambulance away from the house, and just get everyone out safely. I'm not trained for fires. I'm trained for, you know, medical emergencies, not so much for fires, but I'm glad I was there, right place, right time. I was scared for the people inside the house, you know, I was scared for the patient's family. I wanted to make sure everyone got out okay, but, you know, I'm glad everyone did. I'm very appreciative and thankful. I don't do it for the recognition, I don't do it for the awards. I do it because it's my job and I love doing it, but you know, it's a pat on my back, and I'm very appreciative. It's nice to know that I made an impact on someone's life, even if it was for, you know, 30 minutes, that I made a positive impact, and that's all I'm trying to do, is just help people.
Wow. Joining me once again, Kevin Ferrati, Catholic Health's Vice President of Emergency Medical Services, and wow, I have to say it again, that's a family of 5. Like, they're just driving to go drop a patient off, correct? And
something they do every single day, something that they never think twice of doing, and they were right place, right time. If they were just a minute later, we don't even want to think of what could have happened.
Yeah, and I made an impact. Boy, you made an impact, Ryan. You really, and his partner, who wasn't able to make it that day, and we want to give his partner some credit too, who was
EMT Semi Yalkegi and EMT Ryan Pappas. They were instrumental. So as Ryan was in the home helping, Semi stayed with the patient, caring for them, making sure that they were calm, keeping them up to date. So then when we were able to finally get the fire department there, they brought the patient back to the hospital and made sure there was a safe handoff back at the hospital. Fantastic.
I love watching you watch that package, because you are so proud. It's just like everybody at Catholic Health has to be so proud of them.
We are incredible. You know, it was so great for that instance when we were able to award them. Our CEO, Gary Havokin, our entire leadership team, everybody from the highest at Catholic Health all the way down to our entry-level staff were there to celebrate it. And it truly was a celebration, which was fantastic.
And we're watching it, and you're saying really the difference a minute could have made in that situation, right?
That fire spread, and there's actually video that we were able to see afterwards, where just as he's walking down the stairs, you could see the orange glow growing in the upstairs. It was truly profound moment of seconds, and truly seconds did matter in that instance.
And there was a baby in the home too?
There was a baby, there were other kids, there were other family members that without Ryan and Simi at that side, at that moment, helping them, we're just very blessed and very fortunate. It was truly divine
gonna
intervention.
Exactly, divine. Oh, Kevin, we appreciate it. And so proud of what they did. I know you are. I love watching you watch them.
Yeah, thank
That's
you.
so great.
It's fantastic to be able to represent them in this light, because they truly deserve all of the respect.
Thank you very much. Well, coming up next, Kevin joins Catholic Health's Tim Kelchner for a closer look at one of Catholic Health's new ED on Wheels. We will be right back.
We put food back on tables, support local workers, unlock doors, and walk together on the road back. Help Catholic Charities serve your neighbors in need. Join us at wearethere.us.
At St. Francis Heart Center, we're not just regional heart experts. We share our greater success with the world. We don't just pioneer technology. We do it more than anywhere on Greater Long Island. And we don't just win awards. We deliver greater outcomes for people like you. As New York's only specialty designated cardiac center, we're not satisfied with just being good. This is Long Island. This is St. Francis Heart Center. And greater lives here.
Welcome back to Catholic Health Conversations in Care. And today we're talking about Catholic Health's Medical Emergency Services, which has a new in-house ambulance service. Well, next, Catholic Health's Tim Kelchner takes us inside one of the vehicles. But first, here's a look at the blessing of the fleet and the recent ribbon-cutting ceremony.
We welcome the newest asset of Catholic Health, which is Catholic Health Emergency Medical Services, to our fleet. And what that really does is it finishes, it puts the wrapping on the continuum of care that Catholic Health provides to the patients in the communities. You know, we're there when you're at your greatest need for care. And we're also there to transfer you out of the hospitals when you're done, right? So it's a full onset of care continuum.
This ribbon cutting was about a celebration for all the hard work of everybody to get this company up and running. The integration from the old company, Emergency Ambulance Service, to Catholic Health EMS. Kevin was really the instrument to get that all done. Bringing everybody to the table and bringing the right people to the table who invested themselves. That's the reason why Catholic Health sets itself apart from other agencies, because we take the best, put them together, and have a spiritual spin on it too.
Kevin, such an exciting day for Catholic Health, launching our new EMS program. Can you just provide a little overview of the program?
Yeah, so we're super excited at Catholic Health. The ability to integrate care from the moment of patient onset all the way through definitive care is critical. And the only way to do that at the highest quality care possible is to have your own EMS operation. So we partnered and we looked at a private ambulance company, Emergency Ambulance Service, and through the generosity and the support of our board and our executive leadership team, we were able to successfully do that on St. Patrick's Day, and now going forward with us here.
It's amazing. And we were talking a little bit. We have these beautiful new trucks, so everyone will be able to know that Catholic Health is coming to help out. But many people not realize all of the different services that the ambulances can provide. Can you talk about the care that they provide?
Yeah, so absolutely. So we operate in 3 levels. We operate both on the non-emergency component, where we're transporting patients safely on a stretcher back to homes, back to skilled nursing homes or facilities, but then also and more especially in emergent needs. So the moment that you are in your worst condition, we're there to support you, either at a basic need all the way through the most critically cared, advanced capabilities possible.
Perfect. So we're going to go inside and take a look.
I love it.
All right, this is awesome. So talk about some of the stuff. What are we looking at?
Yeah, so ambulances operate with EMTs, so emergency medical technicians. They're operating at a basic life support level, so providing basic care. All the way through what we do here, which is critical care transport. So using things such as cardiac monitors, IV pumps. So now we're able to take the care that was provided in the emergency department in an ICU, patients on ventilators, balloon pumps, advanced cardiac procedures, and then be able to continue that care all the way through to their next destination. So all of this is in here. It gets very cramped because not only we're seeing it's empty, there's patients, there's more providers sometimes, there's a paramedic, and then obviously the patient in a dire condition, in addition to all the other equipment that we could possibly have.
I know a popular question is, as far as loved ones riding with patients, how does that work?
Yeah, so we want to make sure that anyone operating in our ambulances remain as safe as possible. So what we always say is we're happy to take one caregiver or one family member. They ride up in the front where it's safe. It's safe not only for themselves and the patient, but also and most especially our caregivers.
Wonderful, and I love that description of it's kind of a mobile ED. It has all of the equipment, and you mentioned the only thing it doesn't have is that full care team, but the good news is they're going to transport you to that care team where they'll be waiting for you.
Yeah, this 100% is a mobile emergency department. So we have all the capabilities, advanced airway, cardiac monitoring, all of the equipment. And the only thing that we make sure before we move that patient away is to make sure that the doctor is comfortable handing that care over to the critical care paramedic. And that's why it's equally as important that that Catholic Health physician and provider is turning that care over to a Catholic Health critical care paramedic.
So you have an entire, we always talk about the care team at Catholic Health. Now that care team is extending to the road as well. They're everywhere. As far as how many ambulances we have, what are the numbers in terms of the ambulances and also the EMTs in our squad?
Yeah, so we were able to successfully bring on 180 EMTs, paramedics, emergency dispatchers, and then operating 25 to 30 ambulances throughout Nassau, Suffolk, and Eastern Queens.
Wow, that's really impressive. So Kevin, we have it covered. And you were talking to me just in closing. The future is also very exciting. There's something coming up later this year that will continue to enhance this program.
Yeah, we're very excited. So we just finished our training to be able to provide critical care transport to patients actively on blood transfusions. And we're going to be one of only a select few agencies on Long Island that have that capability. So we're super excited to get that going as quickly as possible.
Exciting stuff. Kevin Ferrati, thank you so much.
Thank you.
Colleen, we'll send it back to you.
Thank you, Tim Kelchner and Kevin Ferrati. And for more information on Catholic Health's emergency medical services, just go to CatholicHealthLI.org, or you can call 866-695-4362. And also the CHS EMS ambulance service phone number is in Nassau County, 516-465-6700. In Suffolk, 631-465-6700. Thank you so much for joining us today. I'm Colleen McVeigh. We'll see you next time on Catholic Health Conversations in Care.